Covered by the diaphragm.
Start.
Liver here covered by the diaphragm, present in the right hypochondriac, left hypochondriac little bit, and the epigastric regions. Two surfaces: the diaphragmatic surface, visceral surface. Diaphragmatic surface roughly anterior, superior, medial, lateral. That and all is not very clear, but roughly a diaphragmatic surface. Visceral surface, one second, diaphragmatic surface. Here you have the falciform ligament, which continues on as the ligamentum teres hepatis, which is a remnant of the fetal umbilical vein.
Left umbilical.
Yeah, left umbilical vein. Only one umbilical vein. Remnant of that, ligamentum teres hepatis, goes on and attaches near the umbilicus on the anterior abdominal wall. Falciform ligament divides the diaphragmatic surface of the liver into two lobes, the right and the left lobes. Visceral surface, four lobes, divided by this inferior vena cava running along the groove for the inferior vena cava, gallbladder present on the fossa for the gallbladder, and here you have the ligamentum venosum, and here should be the ligamentum
Teres hepatis.
yes, but I do not see a proper fissure for it. There should be a proper demarcation. Anyways, next to the gallbladder, quadrate lobe. Behind, next to the inferior vena cava, caudate lobe. Caudate with a C, quadrate with a Q. And then again, right and left lobes. Then.
The
here-
impressions, gastric.
Gastric impressions. What, does anybody know the impressions proper?
This is the gastric.
Pretty sure there is something here. What
Renal
is here?
impression.
Okay.
Renal
Then
comes
here
above
is-
colic.
ಇದು
Colic ಇಲ್ಲಿ.
This is
ಮುಂದೆ
colic.
ಬರುತ್ತೆ. Yes.
This is renal impression. Here will be suprarenal impression. They
Okay.
said.
And what is this?
This is the pylorus impression. Something they said. Like
Pylorus.
quadrate lobe is related to pylorus of this
ಹೌದು.
stomach. Hence, it is the pyloric impression and the first duodenal impression.
Okay.
So gastric, pyloric, and the duodenum. Here comes your right kidney, right suprarenal. Here comes your hepatic
Colic.
flexure.
Colic.
Then
Then this region, can you see?
Hmm.
This region, porta hepatis, contains the hepatic artery, the portal vein, and the bile duct. This is the artery. That should be the vein. I'm assuming this is the bile duct because it does not seem like an artery or a vein. I'm assuming this is the bile, the common hepatic duct. If you go within, you should be able to see it bifurcating into right and left common hepatic. Right, so the portal vein bringing blood from the intestines, this one from the aorta, after
Celiac
branching a
vein.
bunch of times from the aorta, so again bringing oxygenated blood, bile going out, but something needs to drain blood from the liver itself because this is also creating metabolites. So IVC के अंदर you see a bunch of hepatic veins going into the liver itself. This is the one that's going to drain all the deoxygenated blood from the liver and directly into the inferior vena cava, which is again running right here. Sorry, IVC over here. Is there anything else there? Right here. Right, ligaments are not fully done yet. Bare area is here, should extend all the way here.
Like it's on posterior, right?
It should extend all the way here actually.
You just tell the boundaries, like corona.
I'm not fully sure about that dude. Okay, so diaphragm here connected to the liver by what we can see here is the coronary ligament. On the what you can see on this left side, the left triangular ligament over here.
it's visible.
Yeah, this part. The left triangular ligament, right triangular ligament is detached, unfortunately, but it should come here. But yes, gallbladder, wake up.
Venous.
Fundus, body, neck, continues on as cystic duct, which joins into the common hepatic duct to form the bile duct. So yes, this this is the bile duct only. Cystic is under cover of a bunch of connective
You can make
tissue.
out the cystic duct there.
No, not really. It's all do you have tweezers here? Okay, if you see this thing would be the common hepatic, I'm assuming, and it's getting another duct from here, which should be your cystic duct. This thing, can you see it? This thing over here. This would be your cystic duct.
Okay.
That would be your ಕಾಮನ್ ಹೆಪಾಟಿಕ್. ಸ್ವಲ್ಪ ಒಳಗೆ ಹೋಗಿ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಡೆಸೆಕ್ಟ್ ಮಾಡಿದ್ರೆ ರೈಟ್ ಆ್ಯಂಡ್ ಲೆಫ್ಟ್ ಹೆಪಾಟಿಕ್ಕು ಸಿಗುತ್ತೆ. ಬಟ್ ಎಸ್, ದಿಸ್ ಕಂಟಿನ್ಯೂಸ್ ಆನ್ ಆಸ್ ಎಕ್ಸ್ಟ್ರಾ ಹೆಪಾಟಿಕ್ biliary apparatus, right and left common hepatic, right and left hepatic, common hepatic, cystic, common bile duct, CBD receiving pancreatic duct, becoming duct of Versum, coming into ampulla of water, becoming the ampulla of water, opening into the major duodenal papilla, the second part of duodenum. That is done. I think that was all. It is major.